Coming to 11th question. Spinal sensory nucleus of the trigeminal lobe has a second order neuron to carry which sensation? This is the INICET PYQs which was asked in 2017 paper. Let me show you the trigeminal nucleus now. This is the trigeminal nucleus. Okay. This is the mesencephalic part. This is the principal sensory and this is the spinal. Okay. This is the longest nuclei. The mesencephalic part is present in the midbrain. Principal sensory is present in the pons and spinal is present in the medulla. Okay. They asked the spinal sensory carries which sensation? It's easy. It carries pain and temperature. But let's see. The question have asked second order, isn't it? No need to break your head on that second order, first order. The spinal will carry pain, temperature. Sometimes you can relate touch also. But the 2017 question they have asked which of the following is not carried. There the option was proprioception, but the options had a touch also. But the touch at least is nearby to the spinal, right? Some of the fibers of touch will pass here also. But proprioception is purely the mesencephalic. Okay. Here the trigeminal nucleus, that is all the parts, that is ophthalmic, maxillary, mandibular part, will carry the information as a first order neuron and relay in this nucleus. Okay. From here, the nucleus, the information is carried to higher center, that is second order neuron. Okay, here in the higher center, the processing and perception of the information will takes place. Mesencephalic for the proprioception, principal sensory for touch and pressure, for pain and temperature, spinal. How to remember the order? Just imagine, close your eyes and imagine proprioception is the first thing. Okay, now take your index finger and just touch your arm. Okay, then apply pressure on the arm, then leave it. You can feel the pain and also hotness, that is temperature. So hence here the option is pain. Yes. 12th question. At what vertebral level does the part marked in the image lie in a normal anatomical position? They have marked this is the ischial spine. Yes. So ischial spine is related to S5 vertebra. Yes. Ischial spine related to 5th sacral vertebra, which is not given in the option. You can see here, it's not given in the option. It's given lower border of L5, lumbar, no. Disc space between L4 and L5, no. S3, no. It is related to S5, which is very much near to coccyx. Okay, so it is a tip of the coccyx. Next, coming to the 13th one. Which of the following is not a derivative of neural crutch cell? In 2024, the neural crutch cells, there was two questions. One is at May and another might be in the November. So neural crutch cell is also a very, very important question. Ciliary muscles, yes, it is a derivative of neural crutch cell. Ganglions, all the PNS structures, we have learned that it's derived from the neural crutch cell, whereas melanocytes or melanoblasts is also a derivative of neural crutch cell, whereas retinal pigments and epithelium is derived from which one? From neural tube. Okay, neural tube. You can see here. Retinal pigment epithelium is derived from neuroectoderm, which then forms a neural tube. Okay. Neural crutch cells present at the junction of neural tube and ectoderm. It will form a PNS structure and head and neck structures. What all PNS structures you can see? All the ganglions, enteric flexus and sympathetic chain, adrenal medulla, Schwann cells, and melanoblasts and cytes, parafollicular C cells. Whereas head and neck structures, it will form a head and neck skeletons, odontoblasts, pharyngeal arch cartilages, dermis of head and neck, and conotruncal septum of the heart, which is the part of heart which is derived from neural crest cell, that is conotruncal septum. Smooth muscles, or majority of the smooth muscles is derived here, and ciliary muscles of the eyes. Okay, hence you can easily rule out all the options. Ciliary muscles, yes, it is a smooth muscle, whereas this pigment is derived from neural tube, whereas ganglion, all the peripheral neural system is derived from neural crest cell. Melanocytes or melanoblasts is also derived from neural crest cells. 14th one, during walking, the hip bone on the side of the suspended leg is raised by the action of which of the following muscle present in the supporting leg? Here they are asking bone on the side of suspended leg is raised. Okay, one leg is raised by the action of which muscle that is present in the supporting leg. Because this is nothing but a Trendelenburg only. That is by the gluteus medius. You can see here when any leg is raised, the other leg's gluteus medius will support. That is the thing they are asking. Okay. When it is raised, supported by gluteus medius and minimus, which is supplied by which nerve? It is a superior gluteal nerve. This question is very, very important. Yes. Coming to the 15th one, which of the following is the first to be formed by the migration of epiblast along the primitive stage? This is very cute thing. Let me show you. First, there will be epiblast. Okay, you know the epiblast and hypoblast. Okay, let me show you. First, there is epiblast and hypoblast. No, right? So now let's see. This epiblast will stimulate the which structure? Hypoblast. Okay. Then it will replace all this hypoblast and form endoderm. So this is the first form. Okay. Here they have given same thing. Then there will be proliferation of the epiblast. That is nothing but gastrulation, and it will form a primitive streak. And this primitive streak will form what? Mesoderm. After formation of the mesoderm, the remaining epiblast cells will form a what? Ectoderm. These neural crest cells are present in the ectoderm. You can see here. This will form a one pouch like structure, and then it will close and form a neural tube. Okay, first which structure is formed? Endoderm, mesoderm, then ectoderm. Okay, so they have asked first formed, that is endoderm. 16th one, identify the marked structure. What is this? This is actually external carotid artery, which is going to the terminal branch. You can see that is nothing but superficial temporal artery, which is going near the temporal. Here you can see the ear, right? Here. If it was a posterior auricular, it should be near somewhere here, and it's very short course. Okay, so very short artery, so you can't see here. Middle meningeal artery will go very much inside. See, marked structure is the temporal artery, is one of the terminal branch of external carotid artery along with maxillary artery. It travels in front of the ear, see, in front of the ear, and it will pass here. The zygomatic arch will come. it will pass above the zygomatic arch and travel superficially and supply scalp and area around the temple. Okay. The option was another one is posterior auricular, which is small and located posterior to the ear. Can't make out in this image. Okay, we are not radiologist, so they will give you the artery which a MBBS level graduate can identify. Okay, so no need to bang your head here. The occipital artery here you can see very small thing and it lies posteriorly and supplies scalp at the back of head. Middle meningeal artery you can't see in this picture, but it goes inside, okay, in within the cranial cavity and supplies meninges. Okay.